Good afternoon, everyone. Thank you for joining us for today for our second session of the Ensuring Equitable Access to Oral Health Care for Individuals with Intellectual and Developmental Disabilities. I'm Brittany Brown, and I'm the Director of the Office of Oral Health at the Department of Public Health, and I'm going to be the moderator for today's session. If you weren't able to join us yesterday for our first session, a link to the recording will be emailed out after the session has been posted to our website. I just want to start with a few housekeeping items. Everyone has been muted upon entry to minimize background noise. If you have a question, please use the chat box at the bottom of your screen, and we'll moderate questions in the last 15 minutes or so. As I mentioned, these presentations are being recorded, and a link will be shared, and the recording will be posted on our mass.gov webpage. And lastly, there is an evaluation for the session that will be shared shortly after the presentation concludes, and you must complete this evaluation in order to receive dental CEUs. So now I'd like to introduce Kimberly Warsaw, Program Coordinator in the Health and Disability Program with the Massachusetts Department of Public Health, Office of Health Equity. Kimberly is here to discuss meeting the oral health needs of all citizens equitably. Kimberly has a long history of working for equity and inclusion of people with disabilities. She's a graduate of the Stanford University and holds a Master's of Social Work and Macro Social Work from Boston University. She was previously lead investigator and mental health recovery liaison for the Disability Policy Consortium. She has also worked for JVS with a collaborative that focused on hiring people with disabilities. She has interned with the National Empowerment Center, participated in Our Own Voice, and spoken on various platforms about the rights of people with disabilities. Kimberly, please take it away.
Thank you so much, Brittany. Hi, everyone. My name is Kimberly Warsaw. I am, as Brittany mentioned, a program coordinator in the Health and Disability Program at the Office of Health Equity at the Department of Public Health. And today we'll be talking about the other ADA, not the American Dental Association, but the Americans with Disabilities Act, equitably meeting the oral health needs of all citizens. And I'm going to talk about the Americans with Disabilities Act and disabilities in general and how that relates to dentistry. I won't be focusing on intellectual and developmental disabilities so much in this presentation, but speaking to disabilities broadly, knowing that people with intellectual and developmental disabilities may also have other disabilities, and just giving a broad overview. So when you think about your patients, who are you thinking of? About 1 in 5 people in Massachusetts between 1 in 4 and 1 in 5 has a disability. And according to the National Institute of Mental Health, 1 in 5 lives with a mental illness. So, and recently I saw something that said in people's lifetimes, about 1 in 2 people will have a mental health diagnosis. So a lot of people you will be serving have various disabilities. And I'll be referring to many of these disabilities throughout the presentation. I also will be going quite off the slides at some points just to add more, impart more information to you. So, so please feel free to ignore the slides when I'm going off of them. So the learning objectives for this session. By the end of this session, you will be able to recognize multiple health disparities, including oral health disparities faced by people with disabilities. So ways in which people with disabilities have poor health outcomes, we're going to talk about. Recognize the sections of the Americans with Disability Act most relevant to outpatient dental services. So we'll get into some of the nitty-gritties around the ADA and how it affects your dental office, and describe steps that will help people with disability access care in the office. So I'm going to talk about some principles, then I'll talk about the disparities, then I'll talk about the ADA, and then some tips for serving people with different disabilities. I'm also going to be describing the pictures in the bottom right-hand corner when there are pictures on the slides as an accessibility add-on so that people who may not be able to see the pictures will have that information. The picture on the bottom of this slide shows 6 cartoon-like figures holding hands in rainbow colors. The person to the most left is using a wheelchair in green, then there's someone in yellow, a taller person in red, someone in purple, someone in blue, and someone in aqua. Okay. So, is there a way to remove from the top of this chat, the top of this box? I'm sorry, I might need Emily's help for a second. Is there a way to remove the top of this chat box that is making it hard for me to see the slide?
It's floating, so it should disappear, but I'm trying to think. There might be under the more section spot to click and say remove toolbar.
It does not say that. It doesn't, I don't see that. Okay, I will just do my best. Oh, hide floating.
You could change to full view at the top where it says view. Click on full screen and it'll take away everything. Only one you'll see is you won't see the chat box anymore.
I don't see something that says view.
Right at the top. So see at the top of your screen, it has view options.
No, it doesn't say that.
Because if you find where you can do full screen, it'll give you a full screen and you would no longer see the chat box.
Okay, I'll just try and go with what I have. And yeah, so okay. So I can't see the very top of the line, but I'll do my best, the best I can. So make inclusiveness part of how you do your job every day. So every individual, thank you guys for bearing with me there. Appreciated. Every individual sees themselves as just another patient, and this is true whether or not they have a disability. And individuals living with a disability will expect to be treated like everyone else because they are like everyone else. And your goal should be to ensure that your dental care is inclusive and accessible for all patients, including those with disabilities. And on the right-hand side, there's a picture of a green, a purple, and a pink hand representing different people. So going off of this slide a bit, why wouldn't someone want to disclose they have a disability? Well, what if the first thing you learned about me was that I graduated from Stanford in 3 years? You might have one view of who I am, but what if the first thing you learned about me was that I take psychotropic drugs? You might have a very different view. And what if, and this is a real case scenario that happened to me, though I don't recommend what I did from a public health perspective. I'm at the dentist's office and I feel like I will be treated differently if I tell the dentist my list of medications. So I say I'm on none. The dentist looking at me right in my face, you know, how in the dental chair, doesn't believe me. So she starts asking for anxiety or depression, and I am trying to pass as having an invisible disability. And she is making me feel it's visible, and this really hurts. It may be necessary for treatment, but it hurts. And I have other friends who also don't disclose this information to dentists. I have a friend who marked on his on the intake form that he had a mental illness, and then the dentist asked which one, and his diagnosis might be like somewhere in the schizoaffective realm, but he just said depression because of the stigma with it. So people, your patients may not be very forthcoming in telling you what diagnoses they have. This may also be true for people who use opioids or HIV meds. People may be very afraid to disclose. So how do you make your office a place where people want to disclose? Just as there may be signs that say LGBTQ safe, maybe there could be a similar sign or logo that indicates you're safe for people with psychiatric diagnoses or HIV or who have opioid use. Because these medications I take do affect the amount of saliva in my mouth, for example, this is important for people to know. And people with psychiatric diagnoses of quote unquote severe mental illness have 2.7 times the likelihood of losing all their teeth. So it's good to know. So what does being disability safe mean? It means recognizing we're people first. Yet it is important to know, as I've said, how people are feeling at the dental office and what they're coming in with. About half of patients have some dental anxiety, and many have experienced dental trauma. And anxiety and depression can exacerbate the perception of dental pain. So create a safe space and ask people what they need early and often. This is especially important for people with trauma histories or panic attacks. And for people with disabilities affecting their executive functioning, it can be hard to stick to a brushing routine. So keep an eye on how you talk to them about brushing and flossing, as patients can feel ashamed, and it may be hard to admit that they have trouble developing a routine. Anorexia can lead to gingivitis. Changes in salivary secreting have been seen in patients with bulimia. So create a safe space for people to disclose. This is crucial. And treat everyone as a human first. We can't be reduced to just one word, which is our diagnosis. We're all much more complex than that. So now I have some questions. Throughout this presentation, I'm going to be asking you guys some questions to enter into the chat your answers. How would you get a patient to reveal what medications they're on? What would you do, or what could you say? If you all could just take a moment and enter into the chat any ideas you have for how you do get your patients to reveal what medications they're on, that would be great. And then I think Brittany will read the chat out loud. I'll give you a minute to write. How do you get patients who may be hesitant to reveal what medications they're on to reveal that information?
All right, so we have a couple of thoughts here. Someone said privacy is very important, ensuring the space is safe for them to share, and that is confidential.
Excellent.
And then someone else said, I've always wished for a much more private area to review medical histories than when already sitting in the dental chair with only a short wall of cabinets between patients.
Right. Excellent. Great. Yes. And having and talking about medical history when someone is right in my face may not be the ideal way. You could also have a questionnaire indicating asking these questions. You could say about 1 in 5 of my patients is on psychiatric drugs. I ask every patient about this. This will help with treatment. What you tell me, as someone said in the chat, won't be shared with others. You can have a sign in your office that says stigma-free. You could also advertise at recovery learning communities or in like the NAMI walk brochures, places where people with disabilities go, so people with disabilities know they're welcome. So those were all great ideas. Thank you so much. Okay. So moving on to the next slide. But before we move on, I want to say one thing about disabilities. And that is, there are different views of disabilities. There is both the traditional view in which the individual is impaired and is the problem. And there's also the social constructionist view, which says society wasn't created for me. And so there are functional barriers and attitudinal barriers, and these are the main problems. So social oppression is a problem, not the disability. So I want to make that distinction clear. So why do all healthcare providers need to know about disabilities? Well, people with disabilities are disproportionately affected by health disparities, including oral health. So, and we'll get into more of those disparities. Inadequate oral health is a common secondary condition for people with intellectual and developmental disabilities due to things like lack of training of caregivers, improper brushing, dental anxiety. People with disabilities experience higher rates of social isolation and may have decreased access to oral health care services. So we have a greater burden of oral health disease because we are often underserved and lack access. Medicaid doesn't always cover our care, and many of us are on Medicaid. As far as social isolation, you may be the only person someone is seeing their whole day. So your bedside manner can go a really, really long way. And people are living longer, and anyone who lives long enough will likely experience one or more disabilities in their lifetime. So as the baby boomers age, more people are aging into disabilities, and thus will be protected under the ADA, again, the Americans with Disabilities Act. So who is living with a disability in Massachusetts? And in the bottom right-hand corner, there's a picture of someone pushing a wheelchair. So 1 out of 4 adults report having one or more physical or cognitive disabilities across the country, with similar or slightly less numbers in Massachusetts. So that's like 1 in 4 people that you're serving. And among adults reporting a disability, 1 in 10 requires assistance with personal care or routine activities that may include oral care. So 1 in 10 require assistance with personal care, which could include dental hygiene. So that's a lot of people that you'll be serving. So now I want to talk a little bit about what we found in a statewide health needs assessment that the Health and Disability Program at the Department of Public Health, which I'm part of, did in 2013 to identify the big problems for people with disabilities in Massachusetts. 865 people with disabilities responded to this health needs assessment. And what we found was the biggest need for people with disabilities was affordable housing, with 77% of people saying that that was a big problem for them. The second biggest was adequate dental care. 64% of people said who had disabilities said finding adequate dental care was a problem for them. So that's a lot of people with disabilities in this state. Then 62% said adequate mental health services was difficult to find. Finding a doctor who is sensitive to disability issues, and probably a dentist as well. 55% said that was hard. Transportation to medical appointments, and we'll talk more about transportation, that was hard. Communication supports, 52% said that's hard. So things like Braille and cart readers for people who are deaf or hard of hearing, and we'll talk more about communication support. Managing chronic conditions, 50% found that difficult. Paying for prescription medications, 48% found that difficult. Finding a doctor who accepts public health insurance, and probably a dentist too, 48%. And finding accessible gyms, 45%. So you can see that if you didn't have these things, adequate dental care, affordable housing, adequate mental health services, you're likely going to have a bigger burden of disease. So it's not the disability that makes the disease, but it's because of these social factors around the disability that lead to that. So some self-reported health status. So here we get into some of the disparities faced by people with disabilities. 26% of adults with disabilities reported they have 6 or more of their teeth missing, compared to only 9% of those without. And does oral health and having your teeth missing just affect your mouth? As I'm sure you guys are aware, it doesn't. I was speaking with one man who all of his teeth were missing, and he was afraid to go outside and socialize because he didn't want to have to smile and feel like he was looking really odd. So an accountable care organization was able to get him a new set of teeth, and he's back to being part of his community again. So having teeth missing can be a really big deal in just so many ways. 24% of adults with disabilities are current smokers versus 16% of adults without. And people in psychiatric hospitals, they often take up smoking just to be allowed outside. Before a Fresh Air Act bill was passed, many people in psychiatric hospitals, the only way they could get outside is for a smoke break. So they would take up smoking. So this is a way to see how society has influenced people's smoking habits, rather than saying, oh, that person smokes because of disability X, Y, or Z. And people with psychiatric diagnoses are also targeted by cigarette companies. Diabetes, 16% of adults with disabilities have diabetes versus 9% of those without. Diabetes is common in people with intellectual and developmental disabilities, and nearly 22% of people with diabetes have periodontal disease. For mental health, 22% of adults with disabilities report 15 or more poor days of mental health, compared to 7% of people without disabilities. 33% of adults with disabilities have had depression, compared to 12% of those without. And I want to say that probably with COVID right now, these numbers are just increasing for people with disabilities. And a history of sexual violence. 7% of adult men with disabilities reported sexual violence, compared to 4% of those without. And 24% of adult women with disabilities have experienced sexual violence, compared to 19% of adult women without. And people with intellectual and developmental disabilities have 7 times the rate of sexual violence compared to people without intellectual and developmental disabilities. They have that 7 times that rate. And one of the reasons we as people with disabilities have such high rates of sexual violence is we're seen as an easy target. We're seen as people could just dismiss our story and say, oh, they don't know what they're talking about, or oh, they're crazy, or this or that. So the law is kind of against us in this case. And one thing you can do for trauma survivors in your dental office is ask if they want to wear an X-ray coat during their exam. This can help them feel comfortable and protected. So another question for you guys to put some answers in your chat. Someone comes into your office and says she is a survivor of abuse and hasn't seen a dentist in years because it makes her anxious. What can you do to help? And I'll give you a few moments to put some answers in the chat. Again, the question was, someone comes into your office and says she is a survivor of abuse and hasn't seen a dentist in years because it makes her anxious. What can you do to help her to make it easier for her to go through her appointment? Please take a minute to think about what you could do.
So we have one response so far, and someone said I
Sure.
would start by asking her what she needs from us.
Excellent, exactly. She's an
Similar-
expert in herself, right?
Similarly, someone said ask her what would be helpful,
Great, great.
ask her
Excellent.
how she wants to be treated.
Excellent, very, very good. That's wonderful, yes. So that's the first thing. It definitely is. She made it there, you know. So ask her what she needs. Is there one more answer? Did I see something come in, Brittany?
And yes, another one just came in.
Yeah.
Beyond whatever the patient suggests, ask first. Make a practice of narrating every step and asking permission for everyone.
Great. Consent. Yes. Yes. Great. Excellent. Great. So those are wonderful things. Ask her what she needs. She's an expert in herself. If she wants an X-ray coat, if that'll make her more comfortable, don't shame her. See if gender preferences can be matched, if that makes her feel more comfortable. What soothes her? Does music soothe her? Can you have that going on? Would squeezing something in her hand help her with anxiety? Could there be a hot towelette for her to hold? But right, you all got it completely right. Ask what she needs, you know, that's excellent. Great. So now we're going to switch and talk a bit about the a more technical part about the Americans with Disabilities Act and what you can do to decrease disparities. And in the right-hand corner, there's a picture of 5 people. The person in front is using a wheelchair and has her arms crossed. And there are 4 people standing with their arms on the side behind her as if they're demanding their rights. So the Americans with Disabilities Act of 1990, known as the ADA we're talking about, is a federal law prohibiting discrimination against people with disabilities. Title III of the ADA applies to public accommodations, which include healthcare practitioners like yourself. Title III pertains to, and we'll go into each of these in more depth, facility and physical access, so how to get around the building, communications access, so things like how to communicate with people who are deaf or hard of hearing, or people who are blind or seeing impaired, and policies and procedures like service animal policies and scheduling policies, et cetera, and we'll get into those. And adhering to the ADA guidelines is literally the least you can do as a healthcare provider. So the ADA is about 31 years old, coming up toward the end of this month. It's old enough to drive, drink, and vote, so to speak, and yet people consider it optional, but it's not. It's a civil rights law. The ADA covers professional offices of healthcare providers. For violating the ADA, there's under Title III, for a first violation, you can get fined up to $75,000. For a subsequent violation, it's $150,000. But it's there because everyone deserves proper treatment. And we are looking here at equity. The ADA is here to ensure everyone gets what they need in work, healthcare, and social services. It takes a really broad view of what the individual needs in the setting. Every need needs to be looked at through an individual lens. And your dental office is considered a place of public accommodation, so you are required to serve people with disabilities. So readily achievable barriers, things that can easily be removed, should be removed. It's better not to wait until a person with a disability seeks services, but to start making changes prior to that. So examples of things you can do include making curb cuts, installing offset hinges to widen your doorways for people using wheelchairs or canes and things like that, replacing doorknobs with accessible openers, and designing accessible parking spaces. You may want to do an office inspection to look for areas where you need to make accommodations. And if you rent space, you should ask the owner to remove readily achievable barriers. And we have a tool called the Massachusetts Facility Assessment Tool, which we have a link to at the end, which takes you through your building and can help you see how to make it more accessible. So before going any further, I just want to address what a disability is according to the ADA. And this is just the ADA definition. A person with a disability is defined as a person who is substantially limited in one or more major life activities like walking, talking, learning, or seeing, or has a history of such a limitation, for example, has had cancer in the past, or is perceived as having such a limitation. So if a rumor gets started that someone has a disability which they don't have, they are still protected under the ADA. The ADA also protects people who are associated with the person with a disability in a situation that could be iffy. So and on the bottom right, you see someone with adaptive equipment and someone walking beside that person. So if something came up where both of them were involved, they both would be protected. Okay, so now we're going to go into more of the nitty-gritty. We're going to talk about facility and physical access, communications access, and policies and procedures. So as far as facility and physical access, and in the bottom right-hand corner, there's a picture of someone opening a door for someone, using a wheelchair, and someone getting that person perhaps medication. So things to consider. Is there a door that opens easily so that people with mobility disabilities can enter? Are the doors wide enough for people using wheelchairs? Are the bathrooms accessible? Is there an operating room on a floor that people with disabilities can get to? So we're looking at the accessible entrance, the restroom, the waiting area. Comfortable chairs for people with pain issues or chronic fatigue is something to consider. There are all sorts of ways to make your office feel better for people with disabilities. And now another question for you. How can your steps toward accessibility, some of these steps toward making things more physically accessible or accessible in general, make things easier for everyone? What may be some examples of how things become easier for everyone when you make things easier for people with disabilities? And feel free to pop some ideas into the chat. This is kind of a tough one, but if you have ideas. I'll give you a minute. Okay, well, this is a tough one. So, well, if you have comfortable chairs in the waiting room for people with back issues or for people with chronic fatigue syndrome or things like that, comfortable chairs, everyone loves a comfortable chair. Curb cuts outside your building. This helps people pushing strollers or baggage. You know, if you have a ramp, everyone can use a ramp, but not everyone can use the stairs. Doors that open automatically. This helps people who are carrying packages. Materials and easy to read format for people with intellectual and developmental disabilities may help people whose first language isn't English. Brittany, do we have anything in the chat for that?
We just had someone say bathroom, so if you want to expand upon that, please feel free.
Yeah, please feel free to expand on what you mean by that. Yeah, but wider bathrooms just make it easier for everyone. And grab bars, can help as well. So yeah, great. Okay. Oh, a few more comments. Were there a few more comments, Brittany?
Yes, someone said, how about reaching the sink in water?
Yeah, exactly. That's very important. You know, can someone using a wheelchair reach the sink in water? And that can help other people, that can help younger people. Yeah.
Yep. And the original person who commented said larger bathrooms that could accommodate everyone.
Exactly. Right.
And also that accessible bathrooms are great for parents of young children and the elderly as well.
Yes. Very true. Counters, the space on the counter. And yes, exactly. Great. Any more comments, Brittany?
And lastly, someone said maybe provide a survey to evaluate how to best accommodate within budgets.
Yes, exactly. And we're going to talk about budgets and things like that as we go further. Very good. Thank you. Any more, Brittany? It looks
Yes,
like
we had a couple more come in regarding seating, a combination of seats with and without armrests, and the ability to
so for different people. Yep.
And the ability to do dental exams while people are in their wheelchairs.
Right. Great. Because some people can't transfer. Yes, very good. Okay. So now this slide is kind of wordy, but I'm going to try and break it down for you. This is about communications access. So for people who are deaf or hard of hearing, or people who may be seeing impaired. Okay, the ADA requires the provision of auxiliary aids and services to the extent that doing so is not an undue burden, which means a significant difficulty or expense. So what does this mean? So the ADA requires that things like interpreters or note takers or telephone handset amplifiers or written and large print materials, or telephones that work with hearing aids, things like that, things that help people who may be deaf or hard of hearing or who may be blind. It requires that you guys provide them to the extent that doing so is not an undue burden. So an undue burden takes into account all possible resources, including tax incentives and the nature and cost of the accommodation. So you are required to provide these services as long as it's not an undue burden, which means a significant difficulty or expense. And there's no formula for what is known as a significant difficulty or expense, but consider the overall size of your financial resources of the office and the nature and the cost of the accommodation. So priority should be given to whatever is requested, such as an interpreter. If you find that to be an undue burden, which an interpreter shouldn't be, but if they ask for something which you find is an undue burden for your office, you should provide something else that is as effective as the solution. And you need to work with the patient to determine what is going to be an effective accommodation for them. And if you don't provide what was originally asked for, you should record your decision and rationale for how the aid would be a significant difficulty or undue burden should you not use them. And according to the ADA, when considering an undue burden, a public entity shall take any other action to the maximum extent possible so individuals with disabilities receive the benefits and services provided by your office. Okay. So I'm going to go a little off this slide and talk more about communications access. There's quite a good chance you'll be serving people who are deaf and hard of hearing. According to the Department of Health and Human Services, almost 10% of people could be helped by using a hearing aid, and that doesn't even include people who are deaf. And 2 out of 3 children in 1,000 was born with hearing loss. So this is another question for you. What can you do if someone who's deaf or hard of hearing makes an appointment? How will you communicate? And please put some answers in the chat. How do you communicate with your patients who are deaf or hard of hearing? Any ideas? And I'll give you a minute again.
Someone said, write on a notepad.
Great, great. Have pen and paper available. Yep.
And they said they can include TTY on phone
Yep.
using a whiteboard.
Yeah. TTY, if people use that. The whiteboard. Yeah. Is there another comment?
Yes, we have contact appropriate translators virtually available prior to the appointment.
Yep. Have an interpreter available, either video remote interpreting or present. Yep.
Have a manual with sign language.
Great. Okay. Very good. Great. Those are excellent. And I would add to that some people who are deaf like to be able to text to establish the appointment. So perhaps having a way for them to text would be good. Again, going back to what people said about when we were talking about the anxious patient who had a trauma history, ask what accommodations they need. They are, again, the expert in themselves. So be sure to find out how they communicate. Do they use ASL? Do they lip read? Have an interpreter available. Be aware of the instruments you're using, and I'll talk more about that because of the vibrations and the sensitivity to that. You can establish a hand signal with them. So those are some ways to help. If you're taking x-rays or reading x-rays, be aware of where you are and the light sources in relation to where the interpreter is. So you can communicate with the person who is deaf or hard of hearing. And like with foreign language interpreters, you want to talk to the patient, not the interpreter. And like with foreign language interpreters, you don't want the interpreter to be a relative, such as a child of the patient. You don't want to rely on family and friends as interpreters for competency issues as well as confidentiality issues. Use visual aids like the whiteboard as much as you can. You can provide before and after photos of procedures and graphic explanations of the procedures. Deaf people cannot hear a drill being turned on, so be sure to let them know when you do this. Maybe have a hand signal. They also may be sensitive to vibrations, so some practitioners use a laser or air abrasion rather than a conventional drill. Lip reading shouldn't be relied on unless it's asked for. First of all, you may have a mask on, but also if you don't, or if you have a clear mask, many people who lip read can only do so to some extent. So if that's not asked for, I wouldn't use that. And as far as writing notes, having pen and paper, this can be very useful for short exchanges. So now we're going to talk about some policies and procedures according to the ADA. So providers must make reasonable modifications of policies, practices, and procedures if necessary to provide equal access to care. So a reasonable modification policy should state your office's commitment to make reasonable modifications when the modifications are necessary to afford people with disabilities access to services and programs offered to the public. There is no requirement to make fundamental alterations to your services. Fundamental alterations include services you would not normally provide. So you aren't required to offer services outside your office's legitimate area of expertise if you would not offer those services to an individual without a disability. So if you offer it to someone without a disability, yes, you need to offer it to someone with a disability. But if you don't offer it to people without disabilities, you don't need to people with disabilities, unless you only need to do what is reasonable. So examples of ADA modifications that you would make include allowing service animals in the dental office, and we'll explain more about that, the nitty-gritty of that, in a few seconds. Scheduling a patient needing extra time, a double slot, or, maybe inviting the patient to come in and look at the facilities beforehand to feel comfortable, or allowing the patient with diabetes to have a snack in the waiting room to regulate their sugar, even if sugar is not normally allowed there. Those are some of the modifications you would make. So a question for you. So what if someone comes in to have their tooth extracted and reveals they have HIV? Should you refer that person to an HIV clinic to have their tooth extracted? And this one, I think I'm just going to answer since it's a yes or no question. You shouldn't just refer the person to an HIV clinic, because you would extract the tooth of a patient without HIV. So you need to extract the tooth of a patient with HIV. And a dental office was sued under the ADA for not extracting a tooth of a patient who disclosed they had HIV. The office should have performed the extraction and should not have referred the patient out to have their tooth extracted, as they would have done that for another patient. So now we're going to talk about service animals, and there's a picture of a dog in the corner who's a service animal. So here's some info about policies for service animals. Make sure that all staff know that service animals are welcome, although they may not be allowed in operating rooms or other sterile or highly controlled environments. Not all service dogs are the same size or breed, and not all disabilities are visible. Do not distract, pet, feed, or interact with a service animal. So to determine if an animal is a service animal, if someone enters your building with an animal, to determine if it's a service animal, you can ask two questions. Is the dog a service animal required because of a disability? In what work or task has the dog been trained to perform? You may not ask those questions if it's obvious. For example, when a person is blind or if someone is using a wheelchair. You also may not, for the purpose of establishing if it's a service animal, ask the nature or extent of an individual's disability, require proof that the animal has been certified, trained, or licensed as a service animal, require the animal to wear an identifying vest or tag. They don't have to be in a vest or tag, or ask that the dog demonstrates its ability to perform the task or work. On the other hand, emotional support animals are not considered service animals under the ADA. Emotional support animals have not been trained to perform a specific job or task, but rather to provide comfort. So they are not protected by the ADA, but allowing them into the office could be good practice to establish rapport with your clients and help ensure their comfort. Some people with anxiety or PTSD may take their animal with them everywhere, such as the shower, the bath, outside. So having their animal with them, if possible, could be a good practice. And again, one thing to note is that service dogs aren't allowed necessarily in operating rooms or other highly controlled environments. And so there should be a backup plan for where the dog will be held, if there's a pen, or where it can be held if someone with a service dog is in an operating room. So here's a question for you guys, for everyone here. What if someone comes in with a service animal and an employee is allergic to dogs? What can you do in that situation? And please pop any ideas into the chat. And I'll give you a few minutes here. Again, the question is, what if someone comes in with a service animal and an employee is allergic to dogs? So it's a tough one.
So someone said, allow the employee a break.
Great. Allow them a rest break. Yep. Or a break to take medication as needed. Yep.
Give the employee a break or an assignment in another part of the building as a reasonable accommodation.
Great. Give the employee an assignment somewhere else. Maybe there could be a room that's dog free. Yep. That's always kept dog free. Great. Those are great.
Yes, and Kimberly, I just want to flag that we only have about 8 minutes left of the session.
Oh, okay. Okay, so thank you for telling me that. So those are all great. You can also have an air filter available. You can have a conversation with the people. And what if someone is scared of dogs? Well, the dog should be tame. If it's not, it can be removed. But you could also have a pen for the dog while it's being examined. And now I just want to talk about some logistics. Be aware of constraints around paratransit, such as the ride. The ride is a service that people with disabilities use to get to appointments sometimes. And the ride is notoriously not always on time. So patients may not have a say of when they arrive or leave appointments. They now have part of the ride that uses Ubers and Lyfts, but people may not be familiar with this and may need to schedule the ride, the traditional ride, which they need to schedule 1 to 7 days in advance. If you're assisting someone with filling out forms, make sure you do so in a place of privacy. If a patient tells you about, if someone is blind and they need, you're assisting in filling out forms, or they have an intellectual or developmental disability, try and find a place of privacy. This may not be easy to do in a small setting, but to do what you can. If a patient tells you about trauma or domestic violence or is listing medications, you may want to take that conversation to a confidential area. Dentists must obtain signed informed consent from the patient with a disability or their legal guardian. And the patient should be asked who they want involved with their care, including caregivers and aides. So a few business tips for the dental provider, and there's a picture of a green dollar sign in the corner. So you need to budget for accessibility measures. These are never the responsibility of or charged to the patient. It is a cost of doing business. So put the cost of interpreters in your budget. You're not allowed to pass along the cost of accommodations to the patient or require them to bring their own interpreter. You can build your practice by promoting programs and outreach activities to disability-related organizations. This is to let people with disabilities know they're welcome. So you can promote it to independent living centers that serve people with disabilities. You can promote your practice to recovery learning communities, things like that. Always make business websites and promotional materials available in accessible formats. And we have a link to to formatting guidelines for all audiences, where you can find out more how to make your promotional materials accessible. Include an accessibility statement to ensure patients know you will make accommodations. So you want to say what types of accommodations you know you can make, such as having an accessible location, Braille, sign language interpreters, things like that. And you can have icons to symbolize each. And then you want to make further accommodations as needed. So make sure registration forms and take-home instructions are accessible, and potential participants have multiple ways to contact you: phone, relay for people who are deaf or hard of hearing, email, etc., as we've talked about. And remember, staff may also have disabilities. And in the bottom is pictured a dental staff, a woman who perhaps has a disability. So adhering to the ADA will enhance your workplace for everyone. So if staff disclose they have a disability, make sure you ask how you can support them and what reasonable accommodations you can make. Many disabilities are invisible or can be masked, such as autism. And remember to budget for staff that may need accommodations as well. So some tips. Always ask before touching or assisting someone. Remember that a mobility device is part of someone's personal space. So in the bottom corner, there's someone pushing someone using a wheelchair whose head is down, and hopefully he's asked for permission to push the wheelchair. An old boss of mine who was legally blind was humiliated when someone once came up to her and tied her shoes for her. That was her personal space. She could tie her own shoes. So just remember to respect people's personal space. Keep an open mind, recognize that you will make mistakes and own those mistakes. We're all on a path toward disability justice. So be humble and admit when you're wrong. I've pet a service dog. It just apologized and didn't do that again. We're all on a path to undoing ableism. So now I just have a few more tips for helping people with different varying disabilities. Helping someone who is blind. How would you help someone who is blind find the dental chair? You could ask if you could take their arm. You could describe the room to them. You could pat the chair so that they could hear where it is. Those are some things you could do for them. For someone using a wheelchair, what are some considerations to think about? That they'll need an accessible clinic, they'll need transportation, they'll need to be able to enter and circulate the building, to interact with staff. Are the counters too high, or can they reach the counter? How is transferring to the chair and overcoming discomfort in the chair? Do they need their head to be held? You can position them in the middle of the chair and put pillows on each side. Paying for treatment. Some people who use wheelchairs have use their mouth as a third hand. So as a dentist, you want to be aware of that. Does their chair tilt back? Do they have the muscles to stay in the dental chair? Is there room to transfer, or are there machines blocking that? Are they going to frequently need to change positions, and how will that be for them? If they have cerebral palsy and they have some movement, you don't want to just stop the movement. You want to kind of go with the movement. So think about things like that. For autistic people, some tips, and again, I'm going off of this slide, but some tips include you may want to give them pictures so they know what to expect. They may want to meet the dental hygienist beforehand. You may want to keep the same dental hygienist each time for the person. They may want to wear sunglasses because of the bright light. You also want to be aware of the color of the walls in your office. If it's too bright, that can have an effect. If you're not sure what to do, you can have a conversation and say, I don't have a lot of expertise in this. I'm happy to do research. I can make you aware of other options. I will make a good faith effort, but you should also be honest about your existing level of expertise. And then some just final thoughts. And there are two people shaking hands in the bottom right-hand corner, showing that each person is a valid expert in themselves. Reflect on your own assumptions and biases and avoid prejudgments as much as you can. Include the patient as an expert in the decision-making process. Make sure you always engage in a two-way conversation. That's been a main point we've talked about when developing appropriate medical or dental recommendations. Be humble, acknowledge your own knowledge gaps, and learn from the patient. Again, patient expert in themselves. Focus less on yourself and your self-consciousness and more on the patient. Openness will help to establish trust and shared goals, and adapt with flexibility and creativity in approach to the patient and adapt to the patient's needs. And some helpful websites and tools for you. We have the ada.gov site for more information about all the ADA regulations. If you are creating print materials and you want to make sure they're accessible for everyone, this link has mass.gov/doc/accessible-print-materials-download has accessible print materials for all audiences. If you want to find out how to make your dental office more accessible, we have a Massachusetts facility assessment tool. We'll be launching an online version of that tool soon, but a paper version can be found at mass.gov/doc/Massachusetts-facility-assessment-tool-download. And thank you very, very much. And my contact information is here. I'm at the Health and Disability Program at the Office of Health Equity at the Massachusetts Department of Public Health. And I can be reached at kimberly.warset@mass.gov.
Excellent. Thank you so much, Kimberly.
Sure.
Unfortunately, we've run out of time for questions, but I've popped my email into the chat. If there's anything I can pass on to Kimberly, and her email is also here if anything comes up. But before we jump off, just a reminder that in order to receive CEs, you have to complete the evaluation. And we'll continue this series of sessions next Friday, July 23rd at noon, with a presentation on providing oral health care to individuals with intellectual and developmental disabilities in the private practice dental setting. Thank you so much, everyone.